This OET Nursing letter got a perfect grade A score. If your letters are only getting C and D grades, you're probably not following the steps needed to get a higher score. In this video, I'm going to break down this sample letter and show you step by step how you can get a high score as well. Today, we're looking at a model answer for the Gerald Baker case notes. You can find these case notes on the OET website, and I will also put a link to the PDF in the description below this video. First, let's take a look at the task. When you look at the writing task, you need to see who you're writing to and your purpose for writing to them. So in this task, we can see that we're writing to a senior nurse, and our reason for writing concerns this patient's continued care at a nursing home. Now we understand the task, we can take a look at the sample letter. You can see that this candidate has used appropriate letter format, and they have also organised the information from the case notes into clear, logical paragraphs of appropriate length. We're going to now break down this letter, go through it step by step, and see exactly why it scored a grade A. Let's start with the basics, which is the letter format. This candidate has started with the address of the recipient, the date of writing the letter. They've put a re line, which introduces the patient with their name and age or date of birth. And then they've put dear and then the title and the surname of the recipient. If the case notes don't state the actual name of the recipient, you can simply write dear and their job title. For example, dear nurse. Never write dear sir or madam in an OET letter, as this is not appropriate. Now let's take a look at the first paragraph. You can see that the first paragraph is not very long, only one sentence, and usually one sentence is appropriate for the opening section. It clearly states the reason for writing, which is discharging the patient, and the purpose of the letter is immediately apparent. Now, you want to get this opening paragraph right because it's the first impression the examiner sees of your letter. Remember that for the writing assessment criterion of purpose, you need to make sure your reason for writing is immediately clear and apparent. This means you put your reason for writing in the first subsection. Make sure it's clear. Only one sentence is usually enough for this paragraph, and you're just focusing on why you're writing the letter. Now let's take a look at the next paragraph. So this letter, the candidate has started with the patient's current situation. You can see the paragraph contains information on the medication and the patient's current situation and how they are doing post-operatively. You'll notice that this paragraph only includes what the reader, who we know is a senior nurse, needs to know to continue treating the patient. And you'll notice that there's a good use of a cohesive device here in addition. So a couple of things to note here. Firstly, each letter will be different in terms of the order in which you present the information. You can see that in this letter, the candidate decided to start with the patient's current situation. In other letters, it might be appropriate to start with different information, and you will need to judge that based on the information and the task that you have. Another thing to note about this paragraph is that it only includes information that this recipient needs to know. It's very important when you're writing your OET letter that you don't include all the information from the case notes. You will be assessed on your ability to select the most important details and present them clearly and logically in your letter. Finally, another good thing to note about this letter was that cohesive device in addition. It's a great idea to learn and practice using some cohesive devices in your exam preparation so you can use them to improve the cohesion of your letter. Now let's move on to the next paragraph. So we can see that the candidate has started a new paragraph to introduce a new topic. And this paragraph includes details on the relevant post-surgery information. So they grouped information together in a logical way. There are accurate use of past and present tenses, so this letter gets a high score in language because tenses have been used appropriately. Make sure that you really practice using different tenses in your letter to improve the overall accuracy and clarity. And as you can see, the information is presented clearly and concisely. So some things to take away from this paragraph: make sure that your use of tenses is accurate. Also, when you are writing your sentences, check back and read them for clarity. Ensure that the message is always being communicated in the most clear way possible. If you're doing all of these things, you will be satisfying the writing criteria, and that is how you get a grade A. If you're enjoying this video and finding it useful, but you would like a step-by-step guide on exactly how to approach the writing task, I've made a video for that, which I will link in the description below this video, so why not check that one out next? Now let's continue with the letter. Our final section of the letter is again a new paragraph to introduce a new topic, which is the future actions for this patient, future tests and appointments. Then moving on to the very last part of the letter, this candidate has included a polite sign-off. They've put yours sincerely because they addressed the reader by their name. And you can simply end your letter with your profession, which in this case is charge nurse. Now, a helpful little tip here, because a lot of candidates don't know how to appropriately end their letter. Should I use yours sincerely or yours faithfully? Well, there's a very easy rule for this. If, as in this letter, you address the letter by the recipient's name, for example, Mrs. Smith, then you end the letter with yours sincerely. If the task doesn't give you the recipient's name and you simply put their job title, such as Dear Nurse, you end the letter with yours faithfully. So remember that rule to use the next time you're writing a letter. So let's recap the strong points of this letter to understand why it got a grade A. Firstly, the reason for writing was immediately apparent and sufficiently expanded, so they would get a high score for purpose. All of the content that's been included is relevant and accurate. There is no irrelevant or unnecessary information. All of the sentences are clear and concise. The candidate used some cohesive devices to improve cohesion. Use of language, including tenses, is accurate throughout the letter. They've used the appropriate letter format as well as polite language. And they would get a high score in organisation and layout because the information has been presented in a logical order. So if you are able to do all of these things in your letter, you will definitely see your scores improve. If you're looking for more help, support and expert advice to help you pass the OET exam on the first attempt and avoid spending thousands in retakes, then click here to sign up for our free Fast Pass Masterclass for more expert tips and advice to support you in your OET exam preparation. I will see you there very soon.